So yes, good evening and welcome to the very first live of the Geek Veterinarian. Thank you, ma'am. We have Dr. Nikita Singh, ma'am, with us to talk about NAVLE. Thank you, ma'am. Ma'am, and the floor is all yours. Please, ma'am, I would like to please you to tell us about yourself, ma'am.
First of all, thank you so much, Aman, for inviting me for
Ma'am.
this very important session. And before starting everything, let me introduce myself a little bit. I'm a small animal practitioner, and I'm practicing in small animals since more than 5 years after my graduation. So I did my graduation from Guru Angad Dev Veterinary College, Ludhiana, and here I am to give you a little bit more about my experience. And before starting this whole session, I just want to tell you that this is my personal experience, right? So it's not hard and fast. आप लोगों को जो ठीक लगता है, whatever you feel कि this is something really helpful for your journey of NAVLE, you can definitely pick it up. And if you feel there is a better way, definitely you should go for it. So this is all about my personal experience and my insight of the topic, my understanding of this subject.
Okay, okay, ma'am. So, ma'am, I would like to start with this. Why did you choose NAVLE? What was your first reason to write NAVLE?
Basically, NAVLE is not just an exam to clear to settle abroad, or maybe just for like enhancement of your quality of life. It is also very important and very important exam, like in a way of your concepts. If you are a doctor, if you are a small animal practitioner, you definitely want to improve your concepts, your knowledge on the topics, the medicine topic and the surgery topic, all that. This is one reason why I chose this exam. The other one is after coming into this small animal practice, I thought I saw few of the incidents जो मैंने खुद से experience किए, where I felt कि unfortunately the condition in our country is like we are not getting due respect as a small animal veterinarian or the large animal veterinarian. So
Okay.
this was one of my reason, and other than that, my colleagues, especially a few of my friends, they encouraged me to go for this exam. So this is one of the reason why I chose this exam, especially.
Okay. Can you, ma'am, please tell us about NAVLE, a little bit about NAVLE, to someone who has not heard about NAVLE, or to give a perspective of NAVLE to that person?
Okay. NAVLE is North American Veterinary Licensing Exam. It is not just an exam, it is a step to clear your Doctor of Veterinary Medicine degree, right? It includes few more steps before NAVLE and after NAVLE. First of all,
Okay.
you have to register with the body, with the association, medical association. It could either be American Veterinary Medical Association or Canadian Veterinary Medical Association. So after registration for Asian students or the students who uh, have a degree from a recognized veterinary college, but they are not the non-accredited college by AVMA, so you have to register and you have to clear your basic clinical science examination before NAVLE.
Okay.
Okay. So
Okay.
BCSC, NAVLE, then clinical practice or clinical proficiency exam. In Canadian Veterinary Medical Association, the rule is little different. You have to go for pre-surgical assessment, then CP, clinical proficiency exam. Okay. So this is the basic step or the protocol that you can follow in order to get into the system or the pathway. And NAVLE, as I
Okay.
said, NAVLE, as I said, it is a North American veterinary licensing exam. It contains 360 multiple choice questions. Okay. And among them, 60 would be unscored question. So basically, you will have only 300 questions,
100
out of
question.
which 300 questions is. 60 will
Okay.
be, it's like there is no marks for it, but the trick is you never know which question it is. So it's a total of 6.5 hours of exam. 60 questions each block, 6 blocks. I have made a video also for this whole like detailed this thing NAVLE, how what is NAVLE, how you can go through, what's the exam
We
protocol and
will
all.
we will pin this in the description so they can
Yes.
watch it in their time and completely know it all. So now I think we should move towards the Q&A session. We have got a lot of questions. The
Okay.
first question that I got a brief idea about NAVLE that we have discussed.
Yes.
Like one of my junior asked, I'm in second year, please explain the two ways for giving NAVLE. And as I'm in second year, how should I begin with? When is the right time to start studying for it?
So, for a second year student, I would suggest you. This is a very good opportunity to develop your solid base. Basically, base. If I'm
Okay.
talking about base, it is like your anatomy knowledge, your pathology knowledge, your statistics knowledge, which I feel is very, very important, not in NAVLE, but in BCSC. So NAVLE is all about clinical exam, but BCSC, it's subject wise. So it includes pathology, it includes anatomy, it includes statistics, AGB, pharmac. So if you are a second year student, it's a wonderful opportunity for you to learn, because most of the pass outs from veterinary degree, they are really struggling with all these basics. So it will make you way ahead of others if you start preparing for these subjects. First of all, the second thing, there are two pathways, as I told you earlier also, like AVMA, CVMA. You can choose either of them as per your comfort or other conditions also. Yes.
Okay. Okay. So, man, the second question was, when is the right time to start studying for it? Like when one should give it a try, or like when's the right time?
Okay. So there are three exams for that matter. One is BCSC, second is NAVLE, third is CP. So if you are talking about the degree, getting a degree of DVM, so there you have to go for three exams. First exam is the
Okay.
BCSE, that you can start from second year also if you want. But for NAVLE, I think the best time is from third to fourth year, because from third year onward you will have your clinical practice started, right? So you can
Yes.
start preparing your NAVLE from fourth year onward. You should start with Merck manual. So this is all my experience. From Merck manual you can start the initial few hundred pages of Merck, which includes small animal practice, small animal basics. So this is the, like, fourth year is the perfect time to start your practice, your this whole process.
Okay. So first thing is one should clear their basics like
Yes, very
physiology,
important.
anatomy, pathology, all these, and then they should start with third year or fourth year. We can say like third year you can start clearing by your basics, and in the fourth year they can start with the clinical practice and all.
Yes,
Okay.
yes.
Moving forward with the next question. Okay. Here it is. The syllabus is very different. How should one deal with that on starting? As we know in Asia, bovines are core species in the syllabus, and how one should deal with this when starting to prepare for NAVLE. Ma'am, your thoughts on this?
So, I'm just sharing my take on this subject thing. Syllabus is all same. There is nothing different. So, if you are
Okay.
starting from the clinical medicine, each and every disease you will study in third year. Each and every disease,
Hmm.
they will ask the same disease. Maybe the focus will be more on this, on the diseases which is like prevalent in North America or US or Canada. You would, it's like that. So syllabus to same here, syllabus is all same, but yes, you have to focus more on canines and feline practice, as I suggested you. And I can show you this this thing also. I made this presentation earlier, so you can see here, this canine and feline, it includes
Yes.
almost 46% of the paper. So you can very
Okay.
well aware, you can just like make out that this is the perfect species that you have to focus right now. Okay, you can take this screenshot also, whatever you want, but I feel the syllabus is all same. Few topics, few species you have to focus more, I feel. Bovine practice, we are saying it more because India is like an agricultural country. Maybe,
Agriculture-based country.
yes, yes. So opportunities in rural sector or in government veterinary officer vacancies, our main focus is like on veterinary officer or government vacancies. But syllabus is all same. It's just you have to
Okay.
switch your focus a little bit towards the clinical aspect or the small animal aspect also.
Okay. And ma'am, what study material did you use for preparing, and did you use any resources like wet prep or Zuko reviews?
Yes. So for BCSE, I took Zuku. Zuku is a very
Okay,
good test series for BCSE because they provide you syllabus subject wise. This thing subject wise like pharmac, anatomy, toxicology. So for BCSE, I took Zuku. For this NAVLE, I took Vet Prep. And if you are talking about
okay,
books, good books, then Mark is my number one go-to book, and the
okay.
Nerd Manual, Saunders Comprehensive Guide. These three books, though, I would say you should always refer if you are practicing, if you are taking any test series, well and good. But whatever questions you are seeing there, the practice question, you should always focus on the disease also, the topic basically. From this Merck
Uh,
manual, Saunders, and this thing, Nerd book, veterinary book.
Ma'am, can you tell a little bit more about the disease you said? Focus on the disease. A little bit
Okay.
about that.
So yes, my strategy used to be like I in the morning time I used to study the my week topics. Then whatever topics you are practicing in vet prep, practice question. So your trick should be like that. You have to read one question, then you have to make 10 questions out of it. If you are reading one question,
Okay,
you have to make 10 questions concept wise. I am talking. Let's say if there is a question on dilated cardiac myopathy, right? So,
okay,
question is one single question, but now you are aware that there is a disease called dilated cardiomyopathy. So you have to study that disease from either Merck Manual or Nerd or Saunders. So the main idea is you should have all your concepts clear, basics clear of one particular topic. It's not about one question. It is about how you are preparing one particular condition because questions may never repeat. But if your concepts are clear, definitely you will attempt it correctly.
okay, okay. So they should refer to Marx, Saunders, and Yang's Nerd book.
Yes.
Okay. Ma'am, all these books are available online, if I'm right. Are these
Nerd
online
is
or
available. Nerd is available, and
okay,
Saunders. Saunders, I think you have to see. I got it from one of my senior, and Nerd is available online. Yes, you can get it.
okay, okay. Then more the audience can be a little bit relaxed because both the books are available online. And for
Yes,
Saunders, you have to find a
yes.
little bit.
I
Ma'am,
feel
can it be
two
said? Uh,
books,
yes, ma'am, please.
two books are more than enough. If you are reading one book 100 times, is way better than reading 100 books single time. So you can read one book
Okay,
thoroughly. That will be great.
okay. And ma'am, next question is, what was your routine like back in the day when you started? What was it like? You were, yeah, as I remember, you started your preparation during your fifth year, if I am right.
Yes, fifth year I just
Okay,
read Merck Manual, the
okay,
starting portion of Merck Manual, which includes endocrinology, urinary system, and infectious diseases of small animal. So this was my
okay,
routine in fifth year. But after that, honestly, I took 6 months of gap to completely focus on my preparation. Okay, so I used to study for 10 hours in a day, and early morning I used to focus on my weak part because we all know morning time your focus is more. So you always have to focus on your weak topics, weak points that you want to focus more or learn more. Okay. So after that, I used to attempt wet prep questions, practice questions, and my strategy used to be I write 10 more questions out of one question, and also the topic. The question is all about the
okay,
topic, one topic. Then in evening time, I used to read those topics clearly, thoroughly from either Merck or Nerd or this NAVLE Comprehensive Saunders topic. You should have proper knowledge, proper base, and also 10 questions, 10 concepts, different concepts you are making out of it. And also you have to read full explanation of each and every question, because I think
okay.
explanation is more important than question, because explanation itself contain 10 more concepts, so you have to focus on that. Aman, can you hear me?
Hello.
Can you hear me?
Yeah, yeah, yeah. Okay. So we were talking about the routine.
Yes.
Okay.
So morning time, like I said, the week topics, then noon time, wet prep practice questions, then topics and 10 more concepts out of each one question, like that.
Okay. Okay. And ma'am, what topics did you find particularly challenging on the NAVLE and how did you approach studying for them? Like, we can talk about the test series or talk what kind of questions did you find, topics did you find? Is it very individual or is it very general per se?
So my week topics used to be of statistics, AGB. That's why I'm
Ah,
suggesting
same.
the second year student that you should make your concepts really good, because this is the golden opportunity for him or her. Okay, so statistics, AGB, and mainly the non-clinical subjects, like this, even the other species other than small animal, like equines, lameness. So these topics were
Goodness.
my weakness, but like I said, in the morning time, I used to read those topics like hundred of times. So this is how you have to focus on your weakness. There shouldn't be any
All right.
weak point. Like you should try. It's not always possible, but you should try.
Okay. Yes, this question. In your experience, what are the most common mistakes that students make when they are preparing for the NAVLE and how can they avoid them?
Okay. So there are 4 tips for all the
Okay.
NAVLE aspirants. One is time management, which is very important because, like I said, for NAVLE it's all about time management. Each question is almost for around 56 seconds, 56 seconds to 60 seconds. So you have to be really smart, like you have to be really focused. So for that matter, like your study should be like you should do smart study. You should focus more on the important topics first, important species also. Initially, you have to prepare small animals, like I said, also the clinical aspects. So first is time management. Other one is smart study. The third one, which I feel is like comfortable posture, because this is one thing that I did really wrong. I was aware of the
Okay.
time management. Okay, I really studied smart because I knew. But the third point is the comfortable posture, because NAVLE is a time consuming exam. It's almost for 6.5 hours.
Six
Okay,
hours.
and yes, and that too, you are getting only 56 seconds for one question. So if you are not focused because of so many reasons, like uh, if you are in a room where you are attempting your exam, if the chair is not comfortable or it is not on a proper height, if your neck is little straight or little bent, then definitely after 2 3 hours, I can guarantee you your neck will start hurting. So before starting your exam, make sure you are comfortable 100%. Okay, this is
Okay.
something which I feel nobody will tell you, nobody will teach you, but once your focus is out, you are out. So this is the third thing. Second thing is, while preparing, you should always uh, like focus on the topics, concepts and basics. You should never bother ki this question will come or not, that question will come or not. If your concept is clear of one particular topic, you are good. Nobody can like question you, or nobody can beat you. This is like four
Okay.
five things that you should be aware of.
Okay. And now, ma'am, about the clinical, that is the NAVLE, the clinical exam that NAVLE takes. What about the clinical aspect? What are the no procedures like about not about related to the species, but about in general? I'm talking about the procedures, clinical procedures.
So this CP, if you're talking about the clinical proficiency exam, it's a
Yes.
very, it's like very, what I would say, this is totally different. clinical proficiency exam itself contains 7 8 sub exams. So I think it would be great if we'll discuss this thing later on. Maybe I'll make one
All right.
video
Sure,
I
sure.
will share on the YouTube channel. If anybody wants to listen
100%.
to it or see to it, definitely they can go for it. But CP is not something which we can discuss in 5 minutes or 10 minutes, let's say. So this is something which I would like you to just leave it here.
It is bigger than NAVLE itself,
Yes.
can be said.
Yes.
Okay. And now, ma'am, what about this is a very interesting question. My colleague asked this: why it is important to become a first world veterinarian and clear NAVLE?
So this is totally like subjective. I would not say this thing that you should be first world veterinarian or whatever. I feel it's your uh, values, your choice. If you really want to practice abroad, you can definitely go for it. If you want to just make your concept sharp, or if you want to practice here only but you want to get that DVM degree, maybe in future if you want to go there, practice. So basically what I feel, as per my experience, why my seniors or why me or why others, mostly 80% of the doctors, they prefer US or Canada or any other country, is because one thing is the quality of life they are getting.
Okay,
Second thing is work life balance, which is very important. But unfortunately, in our country, this is really, I don't feel, I can't see this thing in very often here. It's like 10 to 11 hours in a day, a doctor or a person, if he or she is working, the quality and the productivity will definitely decrease. So there are so
okay,
many reasons. If one person is choosing one path, definitely there are different reasons, 3 4 reasons. One is the work life balance, quality of life, maybe relatives or some other reasons. These are a few reasons which I feel is like the reasons.
okay. Ma'am, now what about other? There is this question: as many of the Asian vet schools are not recognized by AVMA, and then how can I practice from a clinical perspective treating animals in North America?
So yes, one thing is, so you should know that all the Asian government universities, mostly they are AVMA recognized. Okay, but they are
Okay,
not accredited. So there is a big difference between these two. If you are from a
okay,
recognized college or university, you may not be able to practice there as a veterinary doctor, but you can definitely go there and you can practice as a veterinary assistant. I'm telling you again, if your main focus is to just get used to of their work culture, how they are practicing, you can go. Initially, you can immigrate there as a veterinary assistant with your degree, and you can definitely easily get help of the senior veterinarians there. They will help you throughout the process. They will help you uh, maybe monetarily also, other way also. So I would suggest, I would advise, rather than thinking about going there as a veterinary doctor, because this is very difficult. If you are from a Asian country or some other countries, you can go there as a veterinary assistant and then you can try and you can start registering for your exam. As I told you, in CBMA there is a new rule, you have to be there in person to register. So this is
I think you are trying to say the Canadian Veterinary
Canadian Veterinary Medical
Association.
Association. From December 2021, they have made one rule that you have to be in their territory to register for exam.
Okay,
So this is also one of the reason why I am saying this. You can go there as a veterinary assistant and you can start practicing. If somebody is ready to sponsor you, you can go there.
okay. And ma'am, there's this question: how much does PAVE, that is PAVE process cost, and how much time does it take on an average to prepare for ECFPG? Can you shed a little bit of light on PAVE and ECVFG for those who don't know about these two?
So pave is little costly. I would say more costly. It cost you around 50 to 60 lakhs, though I don't have the exact number. But yes, definitely it will cost you more than 50 lakhs or around 50 or 60 lakhs. So this is the reason why most of the doctors in India, they prefer NAVLE or going through that pathway. Pave is little easier because there you only have to clear your BCSE exam, the basic clinical sciences exam. Then somebody will give you the opportunity to practice under supervision in any of the American college. There you can practice for 1 year and then you can appear for NAVLE and you do not need to go for the clinical practice.
Okay. Okay. And ma'am, what about ECFVG?
So ECFBG is one of the same thing that we are discussing already. ECFBG or National Examination Board. If it is Canada, then it is National Examination Board. If it is America, it is ECVFG. So the pathway
Okay.
is same. It is first registration, then BCSC, then NAVLE, and then clinical proficiency exam.
Okay. So we can say ECVFG leads to NAVLE. It is for those graduates who are not recognized and accredited.
But NAVLE though everybody has to give. In Canada and US also, if you are from their university also, in order to practice, you have to clear NAVLE. Maybe CP is not there for those guys, but they have to clear NAVLE. NAVLE is for everybody. It's universal.
Okay. Okay. There's this question. How much time should a student allocate to studying for NAVLE, and what are some effective study techniques for preparing for the exam?
Okay, so if you are talking about a student who is a college going student who is devoting his most of his time in college, then I would say you have to start from fourth year and start preparing for at least 3 to 4 hours, minimum 3 to 4 hours. Okay, and I took almost 3 to 4 months for BCSC and 6 months for NAVLE. If you are preparing like that, and if
Okay.
you are 100% practitioner, small animal or large animal, then you have to contribute little extra time, like 6 hours or 7 hours. So this is how it is. For a college going student, you can start your preparation from 3 hours to 4 hours onwards.
Okay. A minimum of 3 to 4 hours is required on a daily basis.
Yes, and that too with focus, not just like that.
Yes. Okay. And now, ma'am, finally we are at the very last question. Why one should choose NAVLE over other exams such as RCVS, uh, AVE, that is Australasian Veterinary Examination? Ma'am, what's your stand on this?
So this is, like I said earlier, also this is 100% personal choice. There are so many factors. Like if somebody is having relatives in US or Canada, definitely you will be more comfortable immigrating to that country. And if you are from UK or Australia, your relatives are from Australia, or if you feel like this is one country, it's my dream. Some people they have dreams also. So it's totally 100% personal choice. And one more thing is, as per my experience, I feel this Royal Veterinary College licensing UK exam is little difficult and the success rate is little low as compared to NAVLE. What I've heard
Okay.
from my other colleagues who are already in UK. So I feel this is one reason why people choose NAVLE over Royal Veterinary College.
Yes, even I also remember saying one of our profs saying that RCVS is much more tough than NAVLE or any other
And
examination.
one more thing I would like to add for Australia licensing exam now, if you are a NAVLE or if you are having this certificate of qualification like this license from US or Canada, you can ultimately switch your license from directly from AVMA or CVMA to Australia. It's not a big deal. They
Okay.
don't they consider your this exam also, NAVLE exam also. You just have to
Yeah,
transfer your
yeah, NAVLE gives you upper hand over this AVE.
you can practice in New Zealand also. You can transfer your scores from NAVLE to that.
Okay, okay. Now this was the last question. Finally, ma'am, can you offer any general advice or encouragement to the students who are currently preparing to take NAVLE?
So my only advice is nothing is impossible, and NAVLE is not a rocket science. You have a confined set of uh, topics. You will definitely excel. Just focus and consistency. I would say you have to study not to clear exam, to gain knowledge. If you're
Okay.
making your concepts clear, if you're making your basics strong, nobody will can beat you. I am guarantee you this thing. This is one my advice, that piece of advice is focus, consistency, and a proper guidance with proper goods, referring to good books, and taking one very good test series, because test series will align you. Basically it will align your whole preparation. It will give you daily small targets, so that you can appear and you can be more focused in your preparation. This is what my
Okay.
advice as per my experience.
Okay. Ma'am, can you give an outline to the person who will start their unraveling journey? Like this will say, like after watching this live, from hearing all the motivation and guidance from you, what should be his or her board to start the NAVLE preparation? That outline that he or she should follow.
First of all, to you have to register. That is one thing. If you are
Okay.
already registered with either of the board, AVMA or CVMA, then you are almost half prepared. Like now you have already paid your fees. Now you are mentally prepared. Now you have to go give this exam any which ways. First
Okay.
step is the registration. You have to register. Then start focusing on the topics which cover most of the portion of this exam. So, if I have to give an advice, you should start from canines and felines, okay, and
Okay.
start preparing with one of the good test series, whichever is okay for you. Test series, then your species, canines and felines, each topic, okay, like that. And daily focus and consistency. Basically, you have to register first. Then you have to start preparing for canines, felines, and good books. Like I said, mock manual, nerd manual, and this Saunders Veterinary Comprehensive
Saunders
Guide.
comprehensive.
Yes.
Okay.
Registration is first thing, very important.
Okay, so first thing is registration. Secondly is preparing with concentration, focus, guidance, and
Yes.
enrolling into test series.
Yes. If you have any
Okay,
difficulty in how to proceed further for registration, I have one my video with where I shared all the pathways and protocol how you can go for it, and all the necessary documents you have to make ready to submit. So this is very important. This is the most difficult step for a student who is like very naive, don't know anything about how to start your preparation first.
okay. Subscribe to Dr. Nikita Singh's channel, ma'am's channel, to know more about NAVLE and the clinical aspect of it. So thank you so much, ma'am, for giving us your precious time and your
Pleasure.
guidance related to NAVLE. Thank you
Thank you so much, Aman, for inviting me. Thank you.
so much, ma'am.